we are going to talk about the next question. And our next question says, so here we remove these things and then we talk about the next question. So here is our question, which is D. And the question D states that outline 4 aims of focused antenatal care. Outline 4 aims of focused antenatal care. Now, looking at the aims, really the aims of antenatal care, they're very important. And a long time ago, this term antenatal care followed a defined way, a traditional way in other ways, in which there were regular visits for antenatal care. But due to time, and due to the fact that there was still the disturbing number of death, morbidity recorded, and mortality as a result of the same regular visits, so they decided to come up with a new type of care, antenatal care, and they named it focused antenatal care. And it was good because it gives the healthcare providers more time on one person. And this care focuses only on the quality of care rather than the quantity. We want to give the woman the best out of what we do. And hence, for us to develop that, for us to do that, we want to have more time for this woman. That's where the term focused antenatal care was introduced. And normally women can go for antenatal visits for 4 times during their pregnancy. And it's really quite good because it will help us midwives to identify any abnormalities in the woman and anything that is totally wrong, because we are going to have more time on this woman. So the aims of focused antenatal care are: so the aims of focused antenatal care, number 1, to ensure continuity of care. And how do we ensure continuity of care to our women? Well, of course, as midwives, we need to build, or in other ways, to develop the personal relationship between us and the women who are for antenatal care visits. And this is very important because the women, as we create that personal relationship, are going to be free with us and tell us whatever it is that is wrong with them. They cannot hide anything from us. So we need to build that personal relationship between us and them so that we ensure the continuity of care. And the other thing So it is important that we identify anything that is wrong with the woman before it can advance, because it will, of course, lead to certain complications. So the other thing is that to detect early abnormalities in pregnancy, and once we detect these early abnormalities in pregnant, it is important that we treat them. So, for example, a woman on physical examination, we examine their eye, their mucous membrane, their skin, their hands, their toes for edema, and then you find some abnormalities. It is important for us to treat those abnormalities. For example, when we find that the woman is pallor, of course we suspect jaundice, and that could be due to lack of blood in the body. So we are going to give the women folic acid so that we treat their abnormalities, so that we prevent, and anemia in pregnancy is supposed to be prevented, because once we prevent anemia in pregnancy, we are going to prevent postpartum hemorrhage, and as such we are not going to put the woman at risk of dying as a result of postpartum hemorrhage. The other thing is that we are going to prepare the woman for labor. So suppose we are giving the women the folic acid, the vitamins, and the information that they need on the diet, on what they should do. We are preparing them for labor. For example, when we give them folic acid, of course, we are preparing them not to undergo what we call postpartum hemorrhage as a result of anemia. So it's good to give women folic acid when they are pregnant, so that we don't have such complications as anemia. It is very, very important. And the other thing is to prepare for planned parenthood. As women are coming for antenatal visits, it is very important to make them aware of the preventive measures of pregnancy, so that in other ways they want to try and space in their children, because it is the only place, or it is only us healthcare providers where they can get this information. And it is very important for us to be true and to be specific, accurate in giving them the information that they need. So it is very important to tell them, if you want to space your children, you take this, you do this. For example, if it's family planning, you tell them this type of family planning has got these advantages, also it has some disadvantages. You tell them. You don't hide anything from them. It is very, very important that we are honest with our patients at all times. Of course, I've run out of spaces, but there are a lot of aims for antenatal care. For example, we prepare for a successful breastfeeding in a woman. We teach them how to breastfeed their children. When babies are born, they are supposed to be breastfed regularly, especially in the first 6 months. There is supposed to be the regularity in breastfeeding the baby. So it is very important that we give them the health education on how to breastfeed the woman. And the next question, the last question, I'll do it in the next series, in the next video. And this one specifically focuses on antenatal booking. I'll show you the question. And this is the question that carries more marks. It says, discuss the antenatal booking for Mrs. Chimwendo. Now this one, we are going to do it in the next video part.